Welcome to this session of the Open Season Exchange. My guest is Kiran Ahuja. She's the Director of the Office of Personnel Management. Director Ahuja, thank you so much for being here.
Thank you. It's great to be here, Drew.
Great. Today we are talking about the Open Season for Federal Employees Health Benefits Program. Over the next month, FEHB participants will be able to make changes to their healthcare enrollments for next year. It's something that happens around the same time every year, but this year things could be a little bit different. The premium rate increase that OPM just announced was actually quite high for 2023. Those premiums will rise by an average of 8.7% for the enrollees' contribution to FEHB. So Director Ahuja, to start off, OPM typically tries to encourage FEHB participants to take advantage of open season every year. But is that something that you see as more important this year because of that high rate increase?
Thanks, Drew, for the question. I think it's always important during open season to be taking a look at our health plans, as well as our dental and vision, an opportunity to look at your flexible spending accounts to see how you can offset out of pocket medical or dependent care expenses. So we're really trying to push that. This is really an important time. I will say when I was a federal employee, a career employee at the time, a number of years ago, during this time, if I had health insurance, I kind of didn't do anything about it. I just said, okay, I'm set. And I think in particular, what we were looking at with the data is that only 2.5% of federal employees during this time actually changed their plan. And so this is not about changing your plan, but I think what you raise is an important point, which is in the context when we're seeing premiums rise in a way that's really a result of a combination of things of coming out of the pandemic, managing an uptick in services when there was actually a lull for a period of time. There's both a combination of what will be the anticipated benefits in the coming year versus what has already been the enrollee experience. There's a whole calculation that our carriers engage in. So I do think even more so, we want our federal employees to take a moment to look at their plans, determine is it the best plan for their life at this moment, both in the cost of the plan as well as the services that those plans provide. I mean, we have about 270 plans as a real repertoire. I mean, you don't get that number for each part of the country, but in total, we have that number. And I think to me, what that states is there's a variety. There's an opportunity to really ensure that you're getting the best plan possible for you or you and your family.
Yeah, the statistic that you shared, the 2.5% of enrollees changing their health coverage last year is quite low. And I also saw that just 0.6% chose to actually switch health insurance carriers during open season last year. So those numbers are quite low. And, maybe it's, like you said, just, inertia where it's easier to stay in a plan than it is to make the change. But can you talk a little bit more about how OPM really tries to lead these efforts, or what messages you're trying to push out to raise awareness around open season and try to raise those numbers?
Absolutely. Well, one, we appreciate what you all are doing here to raise awareness, to get the word out. So thank you very much for doing that. I think more so than ever, as we've managed the pandemic, our health, our mental health is so top of mind. So we want our employees to be focused on this. And so we're doing a number of things to ensure that we're getting the word out. We have a lot of back and forth that we do with agencies. We send out these administration letters around, we're really reminding agencies of their responsibility of communicating these benefits to all their employees. We have a very robust website and webpage or web pages where I encourage individuals to go to opm.gov/open season. There's brochures, there's customer survey reviews or consumer satisfaction surveys that actually assess the plans and describe the benefits. There is really, frankly, lots of information for all our federal government employees and their families to to take a look. There's comparison tools on there, so you can do a little bit of comparison shopping, to see which is the right plan for you and your family. So, we try to really provide as much information as possible. I think, Drew, the real message also here is that it's a bit of a partnership. So we want to give you as much information as possible, but we also really want to send the message of having our employees and their families take the time during this period of open season, which is November 14th through December 12th. Just want to plug that, to spend some time on our website. These type of decisions take a little bit of time. And so it's just, it requires being a bit purposeful, taking time to look at all the various plans and to see which is right for our employees.
And having a tool where you can kind of compare plans or filter down seems like it would be helpful, given that there are 271 different options. So there's a lot to go through. Yes. But, even with all, I don't think it's reasonable to expect that we're going to hit 100% of federal employees, taking advantage of open season. Right. But what would you consider to be a successful open season?
That is such a good question. I agree. It's hard to, it would be hard to determine what that would be, because I think, obviously we see the low number of federal employees and their families that actually switch plans in a given year. But it's hard to measure where those who've actually done the search and decided, that they wanted to actually stay with their plan. I think for me, it really is about, looking, I would say, at the quantitative data on the back end with our website. We do get an uptick on folks who are checking out that information. What I would love to see is just that really jump up, because we are doing multiple pushes, both with media and on our website and with agencies. So to me, that shows a lot of activity and that folks are taking the time. I think for us, I would hope to see an uptick in those that, individuals who are changing their plans, but to say what that number is, I don't think I could probably do that at this point. The message we really want to give here is for families and our employees to take the time to check out which plan is going to be most appropriate for them, that fits with their financial situation as well as their health needs. And I hope to see a little bit of an uptick in that number, but I think it'll give us some room to assess for even following years on what we actually saw this year. Because I think for us, we have been paying attention to this low rate. And I think more so we wanted to double down this year on that particular point.
Maybe we'll see a change next year for some federal employees and retirees who are participating in open season. And I guess that's the side where federal employees and people in the FEHB program really see all of the work on the table. But OPM does work with carriers throughout the entire year to set the benefits and the rates for FEHB. Can you talk a little bit about how OPM works with different health plan providers throughout the year, and what does that process kind of look like?
Sure. OPM really works hard to, throughout the year. I mean, open season, of course, is a lot of activity, but as soon as we're finishing open season, we're working on the next year of what those benefits are going to look like. And there's a lot of conversations back and forth with OPM and our contract carriers. We put out a call letter that lays out areas of focus and interest that goes out to carriers, in the first part of any given year, and then follows with technical guidance. So we spend quite a bit of time ensuring that our health plans are quite comprehensive and that there is variety. We also work with them to ensure, that as we see some of the trends, in particular, there was a lot of work during the time of the pandemic, or the height of the pandemic, a rise in telehealth. Of course, right now, we've focused on a number of different areas, such as maternal health and obesity, assisted reproductive technology, medical foods. There's a number of different areas that we work with them on any given year. And so that is a part of the conversations that we're having with them, as well as working with them on where they think their premiums will be. And it's a pretty rigorous process that we are involved in on our actuary side of looking at the data and what we get back from the healthcare carriers, and then the conversations and negotiations that ensue. So, I think in this particular instance, with the higher than normal premium increases, this is a trend that we're seeing across the country, with very similarly situated large employer-based plans. So I think for us, we were very mindful of that, and I appreciate your attention to this, and I think even more so wanting to ensure that not only the work we do, which we do in any given year, but what more can we do to ensure the level of participation is what it should be with federal employees and their families, so they're picking the right plan for themselves and their families.
Yeah, and I mean, as you said, the higher rates, it's not unique to the FEHB program. A lot of private sector plans have similar increases for next year. Is there anything OPM can do to keep rates lower? How, those conversations that you said that you have with carriers, is there anything that you can do to kind of change that?
Well, there are certain forces at play that, some of the things we can't manage, which is a pandemic. I wish we could. I wish we had more control over that. But I think most health insurance companies and large employer-based carriers, saw a pretty significant uptick. I would want to remind your listeners that we've had very low premium increases in prior years. And so in some ways, what our folks are telling us is that that premium increase for this year is a little bit of a compensation for, all of this is really estimations, right, that happen. And then you actually look at the beneficiary experience over that year to see actually what has been the uptake. And I think, of course, at the time, a few years ago, no one anticipated a pandemic. No one anticipated a real drop in services. And it was really hard to determine when that uptick would happen, right? When folks felt comfortable to go back, when there was a more openness to actually treat other illnesses and medical conditions, because we saw many people actually put elective surgeries on hold and those type of things. So, I think there are forces at play that sometimes make it challenging to be able to manage what's coming. I think we certainly try to achieve a balance between providing comprehensive plans that we know are so important to our enrollees. We hear it all the time, kind of like a real best in class plan that we provide to federal employees, but also the affordability. That is a real balance that we seek to, that we strive for. And that is the work that we will continue to do. In our own analysis and in our work with contract carriers.
So, the premium rates are increasing more than normal, but as you said, it's all about this balance. And I guess just trying to expand the conversation a little bit here, FEHB is just one of many things that OPM offers to federal employees in terms of different types of benefits for the workforce. So what else is on the table that OPM is trying to highlight for federal employees that they can take advantage of?
Sure. Like I mentioned, we offer a suite of benefits. So not only health benefits, but dental and vision. So that's an opportunity to offset expenses, as well as FSA feds, which is, being able to manage out-of-pocket medical and dependent care expenses. And we really do want our employees and their families to take advantage of those benefits and determine if those benefits work well for them. So there is a suite of benefits that employees do get. We hope that they will take advantage of both using the time in open season to do a little bit of interrogating with the plans out there and the one that they may currently hold, as well as even looking at the variety of plans that we have under dental and vision, really spending some time in calculating where they can offset expenses with FSA feds.
The FSA Feds program, and I'm glad that you brought that up, because something that I've seen about that is that only 20% of employees during 2022 actually took advantage of that flexible spending account program. So there's, that leaves a vast majority of federal employees who aren't using FSA Feds. Is that something else, along with just, taking advantage of open season, is that something that OPM is trying to encourage as well?
No, absolutely. And I was pausing there because I'm thinking, Drew, we need to bring you into OPM because you're a great promoter of you're seeing a little bit of a trend here, right? So I think this is not just out of sheer complacency. I think our lives are busy and there's a lot going on. And again, we're hoping with a mix of what we've all collectively gone through with the pandemic and a real focus on health, physical and mental health, as well as managing these premium increases, that we want our employees to spend a little bit of time. So both in what we see in the low number of percentage of employees that change plans, as well as the utilization rate of the FSA Feds, absolutely. There's real money, potential savings that people are kind of leaving on the table here. With the whole range of the plans that we provide. And I will say, the federal government, we strive to be the model employer. We strive to set the real standard around having comprehensive plans that really do minimize expenses for our employees and families. And so there's a range, right? And what your deductible might be, how you want to manage your copays, what type of benefits do you want. That range and kind of the level of how comprehensive our plans are is really a very thoughtful effort on our end, as well as determining, where you might want to ensure a little bit of cost savings down the road. So there's real opportunity here, I think, in many different ways. And what we do hope is during this period of time that folks will take the time to do that.
Great. I want to pivot a little bit because, we've talked a lot about open season and FEHB, but there's a lot of other things that OPM has going on right now. And one of the big things that we've seen is OPM publishing the results of the 2022 Federal Employee Viewpoint Survey, or FEVS for short. And a couple of the trends that I saw there were pretty interesting. We saw employee engagement was relatively steady from 2021, but some other indices like the pay and job satisfaction both declined. So is there anything that you can point to as some of the reasons behind what you've seen in the biggest trends from FEVS this year?
Sure. Well, I think what's been really interesting is to see that despite that it's been really historic looking at the broader Gallup poll data and what we're seeing across the private sector, that we've actually seen a drop in employee engagement scores that we really haven't seen for some time. I think for us, the employee engagement index has held pretty steady over time and certainly has been on an upward trend since, for the past 10 years. I think that speaks to the satisfaction overall that employees have. They feel engaged, they're motivated, they're committed to federal service, they trust their supervisors and the work that they're doing as a team. And so I think that is a really important barometer for us. And I will just mention that, the employee engagement index is of focus to us on the President's Management Council because it is a big part of the President's management agenda. We use a number of metrics that are in the FEVS, including the Employee Engagement Index, as a barometer for the work we want to do across the agencies. Certainly, there are areas for work and improvement, and that is a big part of what we're trying to promote with agencies, which is, the data is only useful if we actually take action on it. So see where you're doing well, and then also see where you could be spending more time and giving more attention to areas that are provide room for growth for those agencies. I will say that yes, there was a dip in the global satisfaction. You know, the Biden-Harris administration has been committed to increasing pay for federal workers. You know, in prior years before our time, there was a fairly modest uptick in pay, and there's been a real commitment by our president in successive years. The most recent proposed 4.6% increase for 23 if it was to go into effect. So we acknowledge both what we need to do in the experience that employees have on their job. You know, I always say we win on mission in the federal government. So how do we, and we have very committed employees who have been absolutely resilient during the pandemic, but we also know that pay is an important factor, and we're committed to that as well. And hopefully, you know, folks have seen the commitment in successive years, in addition to our proposal right now for the 23 budget. So those are some of the things that I'm seeing, Drew. I think what's also interesting, you know, that I'd love to talk about is the DEIA index, which I think has some interesting data. We've put out also additional and new questions around innovation, resilience. Certainly we're asking about telework and remote work. It's a fairly robust survey, one of the largest. You know, I believe about 1.6 million individuals were sent the survey, and we received, I think, over 500,000 responses. So it's a pretty sizable survey that I think it's going to be quite useful if we think about the size of the government and also how we want agencies to be able to use these data.
Yeah, the DEIA index, that's a new thing for FEVs, and I found that really interesting to kind of look into, and something where you've said it's going to be kind of a benchmark that you'll measure changes over the long term. And in FEHB, there's also, it seems like, some work there with you mentioned maternal health expanded coverage, and that's trying to address some inequalities there. So it seems to be an interesting part as well. But I think that just to wrap up our conversation here, what is going back to FEHB and open season and all that's going on there, what's the one final message that you would want to leave our audience with, the people who have tuned in for this, on why they should participate in open season this year?
I guess I would give a call to action, which is, I hope, every federal employee who's listening to this interview and checking out information on your website, and of course, coming to opm.gov/open season, is taking even just a few minutes to look at their plans, to determine if it's the best plan for them, and also look at the suite of benefits that we're providing, and that we have a whole host of resources on our website that we believe will be useful, and that we work hard to ensure that we can position the federal government as a model employer. And I think a big part of that is making sure that our employees are healthy and thriving, and that are continue to stay committed, as they always are, to the work of the federal service.
That's all the time that we have for today. So let me thank my guest. Kiran Ahuja is the Director of the Office of Personnel Management. I'm Drew Friedman. Now let me send you back to the studio for more of the Open Season Exchange on Federal News Network.